said healthcare is boring and stuffy. I'm going to tell you I did. However, guess what? This next session is far from it. We are bringing you an exclusive preview of an awesome digital health event happening this summer in Europe. I don't know why I wasn't invited, but that's okay. It brings together technology, consumer electronics, healthcare, and sports to showcase to the world how powerful digital health really is. And one of the key players is here for you to give you this sneak preview. Jake Leach is from Dexcom, Vice President of R&D for Dexcom. And he's a third-generation Californian. His grandparents were actually born and raised in SoCal, as are mine. That's great. And and he loves offshore sailing. So, thank you.
Thank you, Jill. I am a California boy. I'm going to try and refrain from using the word dude. So I'd first like to start off by thanking the organizers for allowing me to speak today. It's a real pleasure to be here. So, get my slides up. What we're talking about is a digital health road trip. Do I need to press anything on here? So Dexcom. Dexcom is a local San Diego company. We are in the business of designing and manufacturing continuous glucose monitors. So it's a little bit different type of a glucose monitor than your typical finger stick meter. We've been in the business for over 10 years, and we were a startup in San Diego, and now we are over 100 million in sales. All right. That is a picture of me. Is the slide deck up? So I'll tell you a little bit about the road trip while we wait for those slides to come up. So what it is it's a cycling race through Europe. It's 2,100 kilometers. So it goes from Brussels to Barcelona, and it has over 22,000 meters of climbing. So it's really for elite athletes. And what's really unique about the tour is that a lot of the people participating in it are professional cyclists that have diabetes. So it's a perfect opportunity for us to showcase our glucose sensing technology combined with a very special system that we developed for the race. I'd love to show you some pictures of it. I don't know any good jokes, or I'd start telling some. What was that? I can tell you a little bit more about Dexcom. So we've been focused on continuous glucose monitors, and one of the things that's actually challenging about glucose monitors that go in the body versus the finger stick is that they have to last inside a human being for up to 7 days. They can go a little bit longer than that. But the key is that it measures your glucose continuously instead of the finger points, single finger stick measurements. So it's a new way of looking at glucose measuring. We just launched our 4th generation product. So each generation of our product gets much more accurate, much more reliable. We're starting to approach the accuracy and reliability of the finger sticks. So our mission is to replace the finger stick method of measuring glucose and only use continuous glucose monitors. I think I have a flash drive in my pocket that's got the slides on it, if we need. Yeah, you know what? Actually, we can switch this up around. I have a special guest speaker that I have the pleasure to introduce. It's Peter Narrowthin from Insulin Dependence, and they are a local organization. They're actually national, but they're headquartered here. And they promote fitness and healthy lifestyles as part of treatment for diabetes. Peter is a fantastic guy. He happens to also be an endurance athlete. And so he can tell you a little bit about what it's like treating diabetes while participating in an event like the Grand Tour.
Hope it helps.
Yeah.
I don't know if I'm, okay. So we'll save Jake a little bit here. And I'm supposed to be at the end of the talk. I'm a Dexcom user, actually. I have type 1 diabetes. But I can maybe try to give you all some context as we're working on getting the slides together. So thank you, Jake, for inviting me to be here today. I've probably got 5 or 10 minutes. And then if there's time, I can do some Q&A too if people have specific questions. I've had type 1 diabetes for about 12 years. I've been an endurance athlete for just about as long. Since my diagnosis, I've completed 3 Ironman triathlons, probably somewhere around a dozen marathons, handful of ultra-endurance events. So I tend to exercise in big chunks under extreme circumstances, different than what a normal patient with type 1 diabetes would do. I think my perspective is a little bit unique because I've seen the development of diabetes treatments and technologies evolve over the past 30 years, despite the fact that I've only had it for 12. My brother was diagnosed type 1 in 1985 when I was about 5 years old. Both of my parents are healthcare professionals, so when diabetes came into my world, they didn't even have the finger stick technology where you could get the 1 bit of data, 3 to 5 times a day, which is, I think, the standard, unfortunately, in healthcare today. So I've spent the past 8 years, as Jake mentioned, running a nonprofit organization here in San Diego nationally. We have chapters throughout the United States called Insulin Dependence. Our vision is to reduce the burden of diabetes through physical activity and peer support. So we work on the ground with thousands of people who live with type 1 diabetes, who are trying to fight through the complexities of managing diabetes and putting exercise into their daily management plan. So we've shared a lot of their triumphs and their challenges and their perspectives over the years. Jake asked me to talk about my personal experiences as a Dexcom user and as an athlete. And I do want to begin by saying, or just applauding this company's approach to diabetes management. Jake summed it up, but will sum it up, I think, in his presentation by saying that to effectively treat diabetes, you need to know where you're going. And he'll give us a little bit more context in his presentation, I believe. The FDA and healthcare are notoriously slow in applying new standards of care. And unfortunately, where we are now, in my opinion, is still the dark ages. The standard measure for effective diabetes control is the hemoglobin A1C, which is a standard measure, basically a report card of your blood sugars over a 3-month period of time. And Dexcom is really, I think, a disruptive technology in many ways because their approach is, this is where your slides would be helpful. They're ready. Well, we'll get to that, and Jake will tell you a whole lot more. I'll just share with you a little bit about my experiences as an athlete, and we'll let Jake get on stage here. I started exercising intensively as a patient on insulin. When that happened, there was no such thing as CGM technology. I was fortunate enough to have a lot of support around me with my family, my peer groups, and really a whole lot of desire to compete at a high level as an athlete. I needed to be a student of this disease if I wanted to be a successful athlete. I needed to get as much data as I could get my hands on. So I became a self-advocate and fought the healthcare system, went on the black market and got a lot of these really expensive blood testing strips. And it took me about 25 strips a day. They cost about $1 a piece. So when I went on a run, I would stop about every 15 or 30 minutes to test my blood glucose to get that one little piece of data to understand what my blood sugar trend was, whether it was going up or down. I came home and I studied it religiously, and the next time I went back to do a workout, I was much better prepared to encounter whatever unforeseen circumstances would come my way based on my experience during that workout. So over time, I developed a personal algorithm for, based on my experiences biking, running, swimming, eating, whatever it is I was doing in life. It got to the point in 2009 where my algorithm was good enough to kind of be on my own. There was a marathon in Walt Disney World, and I had my pack of 25 blood testing strips and all the food I needed for the day. And a runner bumped into my arm as I was testing, and all of my strips fell on the pavement. So the rest of that race, I needed to go blind without any data points at all. And fortunately, with all the experiences that I had and the personal algorithm I've developed with all of my experiences over the years, I was able to complete that safely and effectively and at a level of performance that I was comfortable with. I mention that because it's wildly unrealistic for 99.9% of the 30 million Americans who are living with type 1 diabetes to go about managing their diabetes like this today. In today's world of mobile technologies and apps, we're not trained to think about something like diabetes in this way anymore. An analogy would be a taxi driver in New York City. 5 years ago, they knew every single alley they needed to get through to get a passenger from point A to point B. But now, really, they'd be completely lost without Google Maps. And I see that in a similar way. I think it's analogous to the way that patients are managing diabetes now. So in a way, it's a little bit concerning to me as an athlete when I think about that. Not really understanding the fundamental principles of insulin and food and exercise, and really having an intimate understanding of how our bodies work with all of that. But without question, the business case for a company like Dexcom is absolutely incredible, and CGM technology, because there's no product like it absolutely on the market, and patients need to have the data and that Jake is about to describe for us. And that consumer demand's only going to go up, and it's going to be a cost saving to patients because they're spending less time on the blood testing strips. It's reducing hospitalizations, it's keeping people in range, and Jake will tell you a lot more about why that's important. What I like about the Grand Tour that Jake mentioned, and he'll tell us more about again, is it does take into account all these different challenges and opportunities and invites into the conversation that you're all having different biological measures that we're not yet considering. For every FDA-regulated device out there, there's probably 10,000 consumer technologies that are generating all sorts of data that one day will help us better understand all of the complexities of type 1 diabetes and patient physiology. What future treatments and technologies will help us ultimately reduce the burden of this disease. So, without further ado, Jake, thanks for that early start.
All right, so we got the slides up. Can you guys start them from the beginning? I wanted to just show the map of where this Grand Tour ride's actually going to go. It's pretty impressive. While they're doing that, we can look at I think maybe my slides are too complex. This is actually a chart of the growth of diabetes in the world. When I started my career, all right, we will start from the top. Okay, Digital Health takes a road trip. I described the tour. It's run over 13 days, so again, way above my amateur cycling ability, but the unique thing is that many of these riders have diabetes and are pro-cyclists. So why we're doing it is it's called the mHealth Grand Tour, and it's being presented by two unique groups. You've got the GSMA, which is actually a trade organization for the mobile phone organization. It basically promotes GSM technology and represents mobile operators around the world. And then the International Diabetes Federation, which is a umbrella organization that represents over 200 diabetes associations across the world, and they support the interests of people who have diabetes. So those two groups are putting it on, and they've selected Dexcom, an interesting group of technology partners here at the bottom. You've got Dexcom, who's a medical device manufacturer, continuous glucose monitors. Ant Plus, which is a commercial consumer fitness company, and then Orange, who's one of the biggest mobile carriers in Europe. So the three of us have collaborated on a system that's going to be worn by the riders during the race. The point of the race is to raise awareness about diabetes and promote mobile health technologies and the possibility of what we can do with these technologies. But let's just for fun, let's look at some of the diabetes numbers, some statistics about it. Every time I update these slides with the newest statistics, it's staggering. Diabetes is a global epidemic. So back when I started my career in medical devices, right around 1995, there were 135 million people in the world with diabetes. 10 years ago, that number grew to 194 million. And today, there's more than 366 million people globally who have diabetes. So that number's more than doubled since 1995. And it's projected that in 2030, there'll be more than 500 million people worldwide that have diabetes. These are really big, big numbers. If you look at just the US alone, today in the US, 1 of 3 children who are born is going to develop diabetes in their lifetime. There's going to be over 5,000 people diagnosed today, and there's going to be all kinds of complications that occur because of diabetes. And it's such a big issue for our healthcare system because we spend 1 out of every 5 healthcare dollars dealing with diabetes. So what's the problem? Why are there complications? Why is it such a hard disease to manage? There's a lot of complexity to it, but one simple way of looking at it is you need to understand glucose values. You need to understand what your glucose numbers are to be able to effectively treat it. You really need to know where the glucose is going before you can figure out what to do next. So you really need to understand glucose before you can start oral meds, insulin, lifestyle changes. So real simply, a person with diabetes who's taken insulin, it's a daily balance every day between hypoglycemia, low blood sugar, hyperglycemia, high blood sugar. The issue is that if you have high blood sugar, there are these long-term complications that will occur throughout your lifetime, potentially. Cardiovascular disease, blindness, kidney failure. On the other end of the spectrum, if your blood sugar is low, there's some very acute, very immediate things that can happen to you. Diminished cognitive function, loss of consciousness. If your glucose actually goes low enough, you can slip into a coma and potentially die. So what a lot of people do is, instead of tightly controlling their diabetes, they just ride their glucose high. They don't want to deal with those immediate acute issues. They're scared of them, so they ride their glucose high. And that would basically be what the data tells us. Basically, not even 50% of the people in the US are achieving what you would consider good glucose control. And there was a really large 10-year study that was conducted called the DCCT, which showed if you do control your blood glucose, you're going to reduce your potential complications by up to 50%. But yet, our treatment isn't that effective today. So what's the cost for all of this? Last year in the US, we spent $245 billion on diabetes. And what it really says is that if you have diabetes, the healthcare system is likely going to spend 2.3 times more money treating you than they would with somebody who doesn't have diabetes. So what is one of the solutions? What's a potential solution to this problem? Well, continuous glucose monitoring can go a long way in helping better manage diabetes. So let's look at an example. This is a patient who's taken 4 finger sticks a day. And if that was the only glucose data you had, you'd say, okay, we're doing pretty good. We took one in the morning, took one at lunch, one at dinner, and the one before bed. And you can see some of the glucose ranges are high, but you'd think that's reasonable control. And you could even draw a line between the two. I've seen meter companies do that. But if you actually lay a continuous glucose trace on top of it, so that's glucose readings every 5 minutes, you can see there's a whole lot more information to that glucose picture than what was shown by the finger sticks. The patient actually dropped low in the middle of the night, was extremely high after breakfast. Basically, the insulin that they took for breakfast didn't work, so they didn't take enough. And they don't actually really get down to their intended glucose range until right before they go to bed. And then the whole story starts over again the next day. Another very acute example is, let's say you take a finger stick and you're 120. You think, okay, euglycemic, I'm good. And you likely wouldn't do anything different. But if your CGM says you're about 120, but you're skyrocketing down, your glucose is dropping very quickly, you would do something completely different. You would eat some carbohydrates. So there's a whole lot of information that CGM provides to you that's not provided when you're doing finger sticks. So Dexcom, as I mentioned before, we just launched our 4th generation product. It is the most accurate system on the market. It's the most reliable. We're very proud of how users have been adopting it. It is the only sensor that can last for 7 days. It's the smallest sensor. And it really is the first CGM system to deliver on what CGM was supposed to do from the very beginning. So the first CGM was launched around 1999, and it wasn't that accurate, wasn't that reliable. This system is much more reliable, much more accurate. And we know that because our patients are telling us that. So what is the future for CGM and glucose monitoring? Smartphone integration. Basically, taking our glucose, our world-class glucose sensors, putting that data onto a smartphone. Now, most of the technology folks in the audience would probably say, yeah, of course. Why didn't you do that before? This is a no-brainer. The difference with CGM is that it's a Class 3 FDA-regulated medical device, so it affords the highest level of regulatory oversight. So this type of integration is going to happen. It's just going to take us a while. We're working very closely with the FDA to achieve this. But you can imagine once the glucose readings are on a mobile phone, the patient doesn't have to carry an extra receiver. There's remote monitoring capability. There's a lot of things that can be done once the data is on a phone and can be moved to the cloud. And so that's where this Grand Tour ride comes in, and our partners at AMP+. What we've done is develop a system that it's a glucose monitor that these riders are going to wear during this tour. It uses AMP+ radio technology to transmit the data to a cell phone. AMP+ is already very heavily used in the cycling industry. Most of the sensors on these bikes already have AMP+ in them. So it was an obvious choice for this prototype product to put it in there. And so what we're doing is the cyclists wear it, the phone is on the bike with them, and it's broadcasting all their glucose readings to the cloud where they can be remotely monitored for the whole 2-week bike ride. And so we thought this is a great time to showcase this concept of a product and put it through the rigors of a 1,300-mile bike ride. And so I did already introduce Peter, and if there's any questions that you guys have for me or him, feel free to grab a mic. And again, we're really excited to be participating in this bike tour. It's a great experience. We're really looking forward to it.
So I have a question on the regulatory side. Congratulations on making it through with a Class 3. And I wasn't quite clear on exactly how you're measuring the glucose levels, and I'm coupling that up with where you're saying you're approaching the accuracy of the finger stick. And I've seen a lot of companies historically that were trying to do non-invasive glucose monitoring, but the standard of the finger stick was so high that they failed to get there, and the consequences are so great that if you're inaccurate. So could you kind of just explain a little more color on how you're measuring it and what the regulatory experience is, or what you might recommend for others?
Sure. So our sensor is based on an enzyme called glucose oxidase, and we actually have a little probe that's mounted on a patch that you wear for 7 days. It's a disposable, and so it's constantly measuring your glucose. It's basically inserted with an applicator, and it's like a piece of fishing line. It's a very small little probe that goes into the skin. Once it's inserted, you can't actually feel it. So that you're wearing that for the entire time, and then it is transmitting your glucose values to your display device. So to your other question about regulatory, so continuous glucose monitors such as ours that measure interstitial glucose have always been Class 3 medical devices since they were initially cleared by the FDA. It's a tough problem, as I mentioned before, in that you have a sensor inside the body, and you have to deal with all the physiology that occurs there. But this was our 4th generation product, so we had 3 others before that each were PMA supplements or original PMAs through the FDA. So we have a lot of experience with the FDA. We have a great regulatory team. To your question about the accuracy of the finger stick meters, when I first started developing glucose sensors in the late 90s, I too thought there's no way we're ever going to get these in-body sensors up to finger stick caliber accuracy. But since the development at Dexcom, I am confident we'll get there. It's just going to take a little bit of time and some more technology development. But if you look right now, more than 25% of our sensors are that kind of quality in terms of the data accuracy. Any other questions?
Quick question.
Sure.
Have you explored what else you can measure through the same sensor?
Yeah, we a little bit. We're pretty focused on glucose sensing. We know we have a lot of runway there. It's still to go. But anything that's an electrochemical sensor that uses an enzyme, there's other things like lactate. We could use that. We could sense that. But right now we're just focused on glucose sensing.
So just back to the question of the accuracy versus the finger prick. There's an enzyme there too. Why is it still? What's the difference? Where is the inaccuracy? At the high end, low end, mid end? Why are 25% as accurate and the others not? Is it a matter of QA? So we're trying to understand what's preventing you and where are the issues.
Sure. So it's a good question. When I started doing this, I thought, why don't we just take a finger stick, put it in the body? Why doesn't it just work? There's two differences. When you put the sensor inside the body, glucose oxidase, part of the reaction is you need oxygen. And so in tissue, there's a much lower amount of available oxygen than there is in the atmosphere. So one of the things you have to do is design a sensor that limits the amount of glucose that it can be seen by the sensor so that it can react with the available oxygen. I could go on for 2 hours about how we do that, but that's part of it, and that's what a lot of people have struggled with, is creating glucose sensors that operate at extremely low oxygen percentages. And then the other part is all of the physiologic things that occur when you have a wound site in a body, macrophages, everything that attack that sensor when you first put it in and for the period that it's in the body, those are very complex physiologic responses that these sensors have to deal with. Yes?
Take it that if you're already using it for the bicycles, it's not temperature or moisture dependent?
No, it's not. There's a little bit of temperature change or glucose or signal change with temperature, but it's very small. And then the moisture it's actually in interstitial fluid, so it's completely hydrated in fluid.
I have one quick question. Getting back to the race for a second. One of the things that I found the most interesting is that, to me, it's going to be one of the more public demonstrations of mobile health, digital health. And so I'm curious what the plans are around publicity. And I know that's probably not exactly, but what do you guys see as the way to kind of get this out to the public? Like, I'm sure that's why they're doing it, correct?
Yeah, they're doing it to basically promote mobile health technologies, and I think a lot of the mobile operators are actually very interested in handling healthcare data on their networks, but they've got questions about how they do it cross-country lines, across the world. And so that's why they're doing it. The GSMA is funding a lot of the race, and they have a number of press releases that they're trying to get the word out about it. It's a big investment for them, so I'm sure they're going to make sure the word gets out.
And will they be tracking the rider like virtually online? I mean, I would think that this is something that would be really cool to be able to track.
It's a great idea. I know they did that at the Tour de France a couple of years ago with some phones where they were tracking heart rate and things. And I think that it's health data, so we are talking about doing that. We're not exactly sure how to distribute their particular patient's glucose data, but there will definitely be trainers and physicians that are tracking these folks in real time while they're doing the rides.
That makes sense.
Okay, well, if there's no other questions, I appreciate your time. Thank you.